Welcome to the Explore Global Health podcast. I'm Dr. Rob Murphy, Executive Director of the Havey Institute for Global Health here at Northwestern University Feinberg School of Medicine. Today's episode comes to you from the annual meeting of the Consortium for Universities in Global Health, where there's a growing recognition that the future of global health depends on how well we understand and protect the natural world that sustains life here on Earth. Our guest, Dr. Stephen Volz, has spent his career at the center of that work. A physicist by training, he's held leadership roles at NASA and NOAA, overseeing one of the most advanced Earth observation systems in the world. Now he's bringing that perspective to CUGH, where he's speaking about how sectors like finance play a critical role in shaping planetary and human health. We are delighted to have him on the show today to talk about his work with CUGH and share his career path to global interdisciplinary work that impacts human health. Dr. Volz, welcome to the show.
Thank you, Rob. Glad to be here.
Tell us what brings you to CUGH this year, and how do you see planetary health shaping the future of global health?
Well, to be fair, I was not aware of CUGH until about a month ago when I met one of your colleagues, Frank Martin, who's a member of the organizing committee for this conference. But when I read about it and heard more about it, I realized that a lot of the work I've been doing in earth science and in satellite observations is so central to the applications that this community relies on. This community delivers to people around the world. The information that we collect, the knowledge that we generate from that information is really essential to understanding how to make good choices when it comes to public health, environmental protections, etc. So it's really a pleasure to be here, even though I come from a completely very remote, actually literally from satellites from space, a whole different environment and watching and observing.
Let's start by talking about your particular career journey as a young person. Who first drew you into science?
Well, I'm a child of the space age. I was born the same year that NASA was formed, and I grew up in the 60s with all of the cartoons, Lost in Space, Space Ghost, Astro Boy. My father was an aerospace engineer, so he would bring home pictures of the Apollo program. To me, that was the most exciting, enticing idea. And it wasn't just, rockets are cool, but it was, we could build these things, and the universe was enormous and vast. And so I was both space age and science fiction both led me to a sort of an appreciation of the wonder of the universe, but also a feeling that you could understand it and you could act in it. You could be an agent, an actor in all of that. You could be an astronaut or a scientist, and you could actually understand what was going on with all that. These guys are so knowledgeable, and that led me to wanting to be a scientist before I even knew what that meant, wanting to learn physics before I really knew what physics was in my early years. And it just never wavered through my years in high school and in college. The abstract notions of physics and the fact that you could envision a phenomenon, and whether it's a billion light years away or when I end up doing research in quantum physics, it's tiny and 10 feet away, but you can never touch it. You can model it in your mind on paper. You could actually realize and model what was happening and understand it. That kind of breadth of from the minuscule to the universal was really what was appealing to me as a scientist, but also the understandability with work was really the part that really drew me in, and I've never lost that. The more you know, the more you learn, and the more you don't know. All of that fed to this constant positive feedback of trying to understand more and do something with it.
You started your academic journey at the University of Virginia, and then you went on to earn your PhD at the University of Illinois Urbana-Champaign. How did that transition shape your path into physics and eventually your career in earth science?
I applied several universities as an undergrad, and I got to Virginia. U of I had 80 faculty members and 300 grad students in physics at the time. Those were the great days back then. I found an advisor who I liked and had a good personality, not who was the PhD guy who was going to get me a Nobel Prize, but I could work with him. He was personable. He was curious like I was. And that was really, if there's a hallmark in my path, is finding people I liked working with on projects that were interesting and fascinating. And that was the thing that hooked me in. And he was doing low temperature physics, quantum mechanics of superfluid helium. And I liked the idea of quantum mechanics. And I just jumped into that. And that's what I studied as a grad student, was superfluid helium physics for two-dimensional superconductors, superfluid.
Is it true that you applied to be an astronaut?
Yep.
In your mid-20s?
Yeah, I did several times. It's something most people who become astronauts have applied many times. Most people who apply many times don't become astronauts. So I applied in my 20s. My vision's not great. I credited the fact that I didn't have good vision, but it's a really hard thing to get picked for. It goes with my earlier theme of being in space and being an astronaut looked really cool.
You did spend years at NASA on major Earth science missions. What did that experience teach you about understanding our planet at scale?
So when I started at NASA with my liquid helium studies, I actually built cryogenic detectors, cooling systems for astrophysics satellites. To measure infrared telescopes in space, you need to be colder than what you're looking at. First project was the cosmic background experiment, looking at the cosmic background, the Big Bang. And I worked on the COBE, which was the cosmic background experiment, which actually won NASA the Nobel Prize for determining without a doubt that we have a microwave background, which is determined by the Big Bang. And that was so cool. I mean, you're looking at the origins of the universe in your first job out of grad school. So I did that for about 10 years, building astrophysics, X-ray satellites, telescopes, infrared telescopes. And then I moved to Colorado for a while building the same thing, but from the industry side. But then I came back to DC working neuroscience. I'd learned through my career development, it wasn't just about the observable that I was looking for, but the team I was working with. So the value of finding a passionate team of really smart people who are smarter than me. Everyone I worked with is smarter than me in what they were experts at, but I found I was very good at bringing them together and working together as teams. I was a good science leader, team leader, project leader, and I loved working with these motivated teams of people. Coming back to Earth science then, we started looking down instead of looking up. From satellites, you look up at the universe or you look down at the Earth. So I turned my camera around and looking down. It really changed the entire perspective because when you see the Earth, you're overwhelmed with information. When you look at the sky, it's mostly black and you're looking for single photons sometimes. You look at the Earth, you're being swamped with data. So it's a question of picking your targets and picking your objects and your investigations. And when you do that, there's sort of a split you go through. One is you have to narrow down your focus to a particular frequency. You want to look at the infrared emissions from leaves, for example, see if leaves are healthy, or you want to see what the surface altimetry of the ocean is. So you need a certain bandwidth of spectrum. You have to block out everything else. I ran the satellite program at NASA where I was over managing a dozen different satellites at once, which are all looking at different things. And I realized there, the holistic view of the Earth is what is really fascinating. Not that the individual ones aren't critical, but how they all come together was what really got me hooked and has kept me hooked ever since in Earth science, is that these are all connected. Obviously, we knew they were, but you had to study them individually and then bring those data together to appreciate how understanding them all really teaches you more about each of the parts by seeing how they're interconnected and interdependent. So you look at one phenomenon, it affects another. And if you weren't looking at both, you wouldn't know that was happening. And if you weren't combining the data from both, you couldn't see the real-time cause and effect of those interdependencies. Talking about getting hooked. I get hooked over and over again on different things. And that hooked me on the holistic, comprehensive Earth system observations of the planet as a whole. It's not just weather or fire or water or oceans. All of these working together is the master puzzle of our era to understand how everything works together.
At NOAA, you led one of the world's most comprehensive Earth observation systems. For our audience today, how does that system connect to the real-world health outcomes? And tell us a little bit about NOAA.
There's a rivalry between NOAA and NASA when it comes to Earth observations. We both build satellites that observe the Earth, but we have different missions. And the mission of NASA is to make headlines and to be discovery, is to be the first, the biggest, the EST things, biggest, fastest, hottest, earliest, etc. Mission of NOAA is to be boring. NOAA provides weather forecasts and fisheries management forecasts and coastal zone management and tidal gauge updates. You don't want to be excited by the latest weather forecast unless you're a storm chaser. You want to know it's reliable, predictable. So we don't want to be on the headlines for what we screw up. What NOAA provides is services. Science and information-based services to the public, as well as stewardship of the environment. So for the fisheries, for example, we manage the United States fisheries system. So we set catch limits for all the major fish inside the U.S. domestic zone, international zone. And we set that based on scientific understanding of the health of the fish species, of the environment that they live in. And we set the limits so that you don't overfish and depopulate it. And sometimes we say no fish catching this year because there was a suppression for whatever reason and they need a year or two to recover. Doesn't make us popular. That's where we make headlines, but it's based on stewardship. I mentioned the holistic understanding of the Earth. In order to do an accurate forecast, you need to have all these different parameters and these measurements done at once. And the customer, everybody in the country is a customer of NOAA. And to a larger extent, most people in the world are, because you rely on the information, the weather information, the traffic management that you get from the airplanes fly because of the information we provide. They fly around storms. They fly away from the poles if there's a solar storm because we give them the warnings. We provide all that information from NOAA on a regular basis. And we model the entire world, the planet's atmosphere and weather through our numerical weather prediction models, which give us those forecasts, those 3, 5, 7-day forecasts.
What's happened to their budget in the current administration?
Oh, it has not been pleasant. The president's proposals have reduced the budget by as much as 25% in a given year. And it really, they call it focusing on the weather mission of NOAA, but it's really, the weather mission cannot be done without focusing on the entire environmental observation mission. You can't study the air and without studying the water. The ocean atmospheric interface drives weather patterns. You can't study the air without knowing what's happening on the land and the vegetation, because it drives soil evaporation and that drives water. So you really have to look at everything. And that's the challenge by this new focus on weather only. So it's not something you're going to see right away, but if we walk away from that holistic assessment and observation of the planet and all of its ecosystem, environmental systems, we will lose the benefits that we've been gaining over the last 20, 30 years from taking that approach.
I imagine it's been very tough on the staff.
It has been, quite frankly, very much so. And it is tough because to be frank, I am on administrative leave now, which means I've been taken away from my position of responsibility. I was in charge of the satellite program at NOAA NEST, the Environmental Satellite Data Information Service. I was the director of that for the past 10.5 years. I was put on leave by the administration, and they have somebody else running that job now, and I'm sort of locked out from my job. And I think largely because, I don't know why, they wouldn't say why, but it's primarily because I was advocating for what I just did, which is you can't not do all of these things. And there are reasons why we do those. For the staff then who remain, and there are many, many dedicated, about 10,000 employees at NOAA, totally dedicated to the work they do. They're trying to do their job without the distraction, which is a lot of this is distraction. And many of them still can. And thank God they're still there doing what they do. But when you hear, 25% budget cuts, you hear we're not going to do atmospheric measurements. We're not going to measure air quality anymore. We're not going to measure ocean surfaces anymore. That is a blow to the history of what we've done, and to those people who focus in that area, it's really very personal disappointment to them.
You've said that we are no longer just the observer in the world. We've become the actors.
That's
Tell me
right.
about that.
So you've heard the reference to the triple planetary crisis, which is the combination of 3 major destructive factors taking place right now: pollution, a biodiversity loss, and climate change. And all 3 of those are affecting the whatever level of balance we had prior to the turn of the 19th century. And all 3 of those are driven largely by human activity. Biodiversity, as we massively farm the land and change the farm habitat, the land habitats, and we deplete the oceans. Pollution, because of our manufacturing processes that provide the lives that we have today and the room that we're in and the internet and all that. And then climate change, because of our dependence on fossil fuels and the like, which is driving CO2 into the atmosphere, which is changing the thermal balance of the world and the planet. So each of those, there are human actors that are driving that. And it's mostly, until about 100 or 200 years ago, we were not the engines of action in the planetary evolution. We are now. To paraphrase a quote from Uncle Ben, with great knowledge comes great responsibility. Since we know this, we know that our actions have consequences. We have a responsibility to take the right actions and to do the right things. And that's something many of us recognize around the world. And when you try and change the status quo, you get a lot of pushback from those who benefit from the status quo. And that's what we're dealing with that right now. But we are the engines of change, and we have to be the actors of correct change as we go forward.
The panel that you're here at CUGH today focuses on nature, financing, and the financiers of nature. Why is it so important for the global health community to understand the role of the financial sector in shaping health outcomes?
It is clear that without resources, you can't make change. You can't make things happen. And the things I just described a few minutes ago about the world that we live in now was created by economic development, by investments, by money, which has made things and raised our awareness of health. A lot of good outcomes from that. We're supporting 8 billion people instead of 1 billion in the last 100-year change. We've changed the life expectancy from 32 years to 72 years. These are incredibly beneficial to humanity. But the consequence has been we have damaged the environment in a way that's non-sustainable. The financial sector comes in there when I think in some of the directions that we've done in the past 20 or 30 years, I'm not a financial manager, but I see when you force a country to create monetary economies of scale, palm oil or other ways, to make for exports, you change that environment. You clear cut forests and build palm oil factories. You make food for export rather than for the local community. You may have factory farms or instead of personal farms, and that displaces numbers of people. And that creates different health environments for those people who are there in those worlds. How do you manage the lives of the people so they have the right health and social environment when you do that? And you can't just say, we need to reduce the value, that we need to produce money and pay off a loan. We need to create a sustainable community at scale, whether it's community scale, state scale, national scale, or global. You have to have sustainability built into economic development activities. And that hasn't been the case historically. And I think that's where the financial sector is learning that, and they're recognizing that. But I think as we go forward, solutions have to be not just viable, but sustainable in the longer term. We don't have the runway anymore to locally optimize and not worry about what's going to happen in 10 and 15 years.
Where do you see the biggest gaps today between environmental data, like what your systems produce, and how it's actually used in global health decision making?
We have a great global understanding of trends and parameters. I'll speak from a perspective of resolution. So we have an excellent moderate resolution map of the planet. And by resolution, maybe at a quarter-mile scale or a 200-meter scale. So we could tell you at a 200-meter scale what every piece of land on the planet is, what its primary productivity is, where the people there are living. And,
this is all satellite?
From satellite data combined with ground truthing, which is, calibration and validation, and immense data sets. And it's not just the U.S. and NOAA, it's all the nations and the Europeans and are collecting these data. Frankly, we have a good global community that's sharing this. So we have a good moderate resolution one, but people act on a much more narrow scale. I mean, you need 1 meter resolution. What are you doing tomorrow with your fuel oil to cook your meal? And we don't have that kind of resolution. So when you have solutions, we use the term the last mile, might be the last kilometer, the last 10 meters now. You have to have solutions that fit people in their environment and in their community, which for most people, they don't travel across the country. They travel across the city or across the street. So the gap is in understanding these applications, this information awareness, and to translate it into action at the local scale. And that's what we're going to talk about this afternoon in the panel I have, about how we're doing that with some examples for heat health and for mosquito tracking and dengue fever, vector-borne diseases, how to connect with those practitioners at the community scale, not so they understand the satellites, they don't need to understand that, but they understand forecasting of what's going to happen in the next 6 weeks and give them ideas on how they can help their communities with information that's been something I demonstrated in Myanmar can be applicable in, South Africa. But we spend millions to understand it over here. With a little bit of tweaking, we can tailor it to South Africa or to Guatemala. That kind of scaling allows us to take local problems and see them at a global scale and find solutions and then expand that in a much more holistic way. And that's where I think the biggest gap is going that last 10 meters to meet the needs of individual families and communities.
You've worked across governments, international agencies, and sectors. And what have you learned about what makes global collaboration actually work?
I'll start with what doesn't make it work. I had an interesting presentation a while ago where somebody was touting the importance and the effectiveness of these entrepreneurs. Elon Musk has created the ability to get to space cheaply. And it's people like that. And look what they've been able to do, big names. And those, and I think are not what make change work at the local level. What happens is people who spend their lives on their passion on something that is important to them, and they feel is important to their families, their communities, and their country, or whatever scale they want to think at, and then find other connections to people who have similar interests. We think of this connection, this conference right here, it's Ugandan practitioners of village health talking to somebody from Guatemala or somebody from Southeast Asia. And they're finding that connection and creating the right environment for that connection to be sustained, creates a community of practice and a community of expertise. And we have a number of good examples in that. In the space domain, we have the WMO, the World Meteorological Organization, which has 180 countries all working together, all doing the meteorological agency activities around the world and doing best practices to try and figure out how to take what's been learned in the wealthy countries and apply it to the less resourced ones. WHO does a similar thing. In my satellite domain, all of us, I was a lead and a member of a number of different international satellite consortia for taking the space agencies, the research agencies around the world, working together to figure out how to collectively raise the value and the efficiency of the work that we do. It's a global approach, looking at the Earth as a whole and looking at humanity. As you said, no boundaries. You don't see those from space. I was reading a chart out here from early teen pregnancy. If I blacked out which country it was, I could have been Atlanta suburbs. And it wasn't. It was Uganda. But it was the same problems shown at different communities. It's taking that different perspective. The problems are common. common, and the solutions can be as well. And we do have networks that allow that to happen. We often have to work in the face of political or national interests that try and identify differences between us. And that's the battle we're facing right now. But the commonality and the common humanity is there, and we just need to keep reinforcing that.
We've been working in the point of care diagnostic technologies area, and because of our international work, we're working with 9 sites in Africa. And so they have very similar problems and needs that in health that we do. The information, it's bidirectional.
Yeah.
It's not one way, and we can learn a lot from our partners.
A message that doesn't get through to a mother in Tishoanee can have the same solution when you're talking to a mother in Mississippi.
Yeah.
You've got to learn how to talk and communicate, and you got to learn how to listen. So
it's really amazing.
Differences are much smaller than the commonalities between us.
And what we're finding is that the technologies that we're developing with our African partners are, of course, much less expensive, more efficient, easier to make. There's many advantages. The way we have our networks in the U.S. for diagnostics is so complicated and involves transporting specimens, maybe hundreds or thousands of miles to get tests, a result that gets done at 2 a.m. in some city, and the information is wired back to the clinicians or clinics or hospitals or whatever, and they have everything there in the morning. That's not going to work around the world. It's too complicated and expensive.
Well, one point, though, about what you just described is something I've learned long ago is most people don't have that end-to-end view, and they don't need it, but they don't want to be worried about all the other complexities. They're good at what they do, and they want to do that. So the essence of a good coalition, collaboration, team, whatever you want to call it, is not making everybody members of the whole team, but finding the place for how their individual expertise, their individual passion can contribute, and providing the right framework for how that can lead to a team performance, a global performance. And that's something that not everybody needs to have, but you need to have somebody who's looking at it that way. I've been lucky enough to be in positions where I could take that role and find ways to get these people to work together and then step back. Chemical sense testing in the suburbs of Cincinnati that's going to show up in the suburbs of Cape Town doesn't need to know where it's going. He or she needs to just know how to do it well and have the right framework so that it gets there. And that's that networking that is really the joy of working as larger teams. And letting people see that they're a part of a larger mission is what they want, not that they have to own the entire mission.
Looking ahead, what gives you hope about the future of planetary health and its integration into global health?
The barriers to data utilization are coming down. The massive increases in computing power is making it ability to do that. Similarly, the explosion of observing systems, and not just satellites, the Internet of Things, the drones, the availability of information is great. So the combination of data infrastructure to accept the data, the observations to collect the data, are enabling a much greater collective understanding of the Earth. So I think that, again, it goes back to what do we do with that? So I think the availability to ask questions and to have them answered is in front of us now in a way that it wasn't when we started creating these global triple problems, but they're there now. That combined with the people growing up in this world of, wow, we got a problem, is going to put the power to change smartly in the hands of the people who are committed to seeing a better solution, a better future for themselves and for their own children.
What advice do you have for young people who are just now embarking or wanting to embark on a career such as yours?
I've always chosen paths that were interesting, challenging, and exciting to my mind and to my sense of what's interesting. And as you've heard me say, it's about answering questions and understanding how things work. And I've gone from job to job and from position to position. What I've learned early on was that the most important thing that I can do as I move to the new one is make sure I'm adding value to what the group wants that I've joined. Not that I'm an expert and they're going to benefit from me being there. I hope they will, but I need to add value. I'm there as an additive to an existing organization. What can I do to make them better? Which means I've got to listen to what they're doing and what they want to do. And that's the real thing, is understanding what group you're moving into and then figuring out how you can help them while doing the things you want to do. And if it turns out what they need is not what you're good at or what you want to do, then okay, you move on. But you don't try and force them to like what you want because you're the smart one. You figure out what they want and you try and add value. And I've always found that if you come in with that perspective, people open up about what they're doing and what their passions are. They're not as protective as they might be about the new guy coming in who's going to change everything. And it's served me well to join teams of really interested and passionate people.
Steve, thanks so much for being on the show today.
Thank you for having me, Rob.
Follow us on Apple Podcasts or wherever you listen to podcasts to hear the latest episodes, and join our community that is dedicated to making a lasting positive impact on global health.